Hi, everyone. Thanks again for joining us. My name is Kate Brandis. I'm with the SecureVideo account management team. I'm joined today by a couple panelists who are joining me this time to help me manage questions as they come in from our audience. So with me today is Sabrina Smith. Sabrina has her camera turned on. Hi, Sabrina. And we also have Michelle Dong and Gina D'Arienzo from SecureVideo's support team. So hopefully we can take care of managing a lot of the questions as we go through today's information. But for now, I'm just going to dive right in. I do have a few minutes after 1. We've planned for an hour for this webinar and presentation just to allow for plenty of time for questions. As with our last webinar, we had quite a few questions and lots of great engagement. So don't be shy. Use the Q&A feature in Zoom if you have questions as we go along. And of course, we'll take some time at the end to dive into some things specifically. But today we're going to be talking about enabling patient convenience, essentially, using SecureVideo's Virtual Clinic feature. In today's webinar, we're going to go through exactly what a virtual clinic is and why it should be important to you to use it. We're going to talk about some different options for the configuration. There are several different ways that this can be set up, and just depending on what the needs of your practice are, we can talk about how those could be useful to you. And then we'll demonstrate each of those configurations. We're going to go over some example workflows, just showing you start to end how the process goes for both the provider, and we'll show you from the client or patient point of view what the experience looks like. We'll also talk about pricing. Now, this is for probably the majority of you on this call, a feature that's included in the cost of your SecureVideo license. But we'll talk about some setups and some situations where there may be some extra cost involved, just so that we're transparent and that you know what to expect. And then, of course, like I said, we'll allow some time for Q&A at the end. Now, after the webinar, I just want to reinforce, we are going to be sending out a link to this recorded webinar. So if you happen to miss any information, just know that it will be sent via email afterwards, and you can always refer back to this later. So we want you to just take your time today, enjoy, watch the presentation, and don't be too worried about, writing things down or anything like that. And just know that our support team is here to help. We have great support via chat, via phone, via email that is ready and willing to help as you decide to get started with this feature. All right, we are going to enable a quick poll here, and this is just to get a sense for where our audience may be in terms of using a virtual clinic. So I'm going to launch this poll here. You'll see this appear on your screen, and if you'll just choose the answer that best describes you, or if it doesn't apply to you, then don't worry about it. But we're just wondering, are you using any booking system right now, or are you just kind of here to learn more? If you're already using the feature but you want to understand it better, or if you're using a completely different system for online appointment booking and just want to look at how SecureVideo may differ. So I'll leave this poll question up for just a moment. We'll let people get answered here. All right, I think we've probably heard from most people here. I'm going to go ahead and end it. Looks like the majority of you are not using any online booking system and are just here to learn more about the feature. So that's great. That's hopefully exactly what we'll do today, and you'll walk away with a better understanding of it and how it may help you. All right, thanks for participating in that. Okay. So next, let's just talk about what a virtual clinic is. Now, you may have heard this referred to using a couple of different names. It's also known as patient-facing scheduling. So you may have heard it referred to as that. You also may have seen in your SecureVideo account a menu option called appointment slots, and it sometimes has been referred to that in the past as well. So at the basis of it, really what we're doing is we're enabling a web page that your patients or your clients can visit so that they can request a session with you or others within your practice. So that's really essentially what a virtual clinic is. It's just giving those clients or patients a virtual appointment booking option. Now, why use the virtual clinic? Because we all want to look like this lady here and be all calm and zen about our appointment process. But really what we're doing is enabling convenience for your patients or for your clients. A lot of people now really expect that if they go to book an appointment with a healthcare provider, that they can do this online, or at least get the process started online. And a lot of times that's not easy, especially for smaller practices that may not be using, an EMR system that allows for this type of workflow. Oftentimes it requires custom development on your website. You have to enable some other kind of third-party software to allow for booking requests, when this is something that you can do through SecureVideo. Another reason is easy online promotion. So once you set this up and enable this feature, you will have a dedicated link for your booking page. And this is something that you can share on your social media. This is something you can include on your website. You can include it even in your email signature, where you can note on there, book an appointment with me today, and include the link to your booking page through SecureVideo. And then easy management by providers. And we'll demonstrate this through the process today. What we're going to do is really show you how easy it is once a patient or client submits their appointment request, how easy it is for you to manage those appointments and really see those convert to actual telehealth sessions on your dashboard. All right, so some of the configuration options that you have within SecureVideo are, one, you can do an appointment-based configuration. And this is where you are going to allow people to request a future appointment at a specific date and time. And that date and time is going to be based on your availability. And you can do that by selecting from a list of providers, essentially. Now, if you have an individual user account in SecureVideo and you're the only provider on your account, this is essentially the option that you're probably going to use because they wouldn't need to select the provider. They're just going to be requesting with you. But some of you may have a situation where you have multiple providers within your account. So you have even 2 or 3 of you that are practicing together in a practice. You may be all under one SecureVideo account, and you have, several of you that want to take advantage of this feature. So what the appointment-based with selecting a provider can do is, as the patient goes in and selects what service they want, they can also select from a list of providers within your account. But the next configuration option is still appointment-based, but you can select from just a provider group. So what this essentially means is the system is going to take all of your aggregated availability, and it's going to let the patient or client just choose a date and time, and then that first available provider can take the appointment. So it just depends. If you're a practice, you really want people to select individual practitioners, they can, or they can select just a scheduled appointment, and it can go to a group of providers. Then we offer also the on-demand configuration, and this is really most commonly used in SecureVideo when we look at like an urgent care type of workflow, where you're wanting to have basically your virtual clinic open, when you need it to be open, and people can request sessions right now. So they're saying, I need to see a provider right away. But the nice thing is you can actually set up a virtual clinic to incorporate both. So you can allow people to not only select a future date and time appointment, but they could also select request a session right now. So let's dive in. We're going to go through some of these configuration options. I'll show you some examples of each, and then we can talk about the workflow and how it all looks. So to start with, I'm going to pull up a provider dashboard here in SecureVideo. This is my demo account that I use most often, East Coast Medicine. You'll see here I have Dr. Ellie Coates. That's me. That's my provider. So Ellie Coates is here in her SecureVideo account. The basis and the place where really it all starts in SecureVideo is through this account services. In your account, you have this account services button where you can go in and decide, all right, which service is it? Which type of appointment do I want to allow my patients or clients to select from? So you'll see in my account, I have quite a few examples here. I have a therapy session set up where they can schedule a one-on-one therapy session. We have some urgent care virtual visits set up. So these are all just examples of different services or different types of appointments that you could offer. But to use the virtual clinic feature, you do want to have at least one service that your patients or clients can choose from. And creating a service is very easy. It's just creating the service here. You determine what the name, the description. If you're going to require payments or incorporate taking copays through the virtual clinic, you can assign a dollar amount for what that payment should be. And then you want to schedule a duration. Now, this is not going to say that the appointment will be limited to this duration. It's just simply saying for scheduling purposes about how long does this take. So for example, you'll see on my list, a therapy session I have at about 1 hour here. So that's all working in the system to help you manage your availability based on how long the average session would take. So let's stop there. We're going to look just back here on Dr. Coates' dashboard. I'm going to pull up now the virtual clinic booking page for East Coast Medicine and show you what that looks like. So here in this browser, we have the virtual clinic for East Coast Medicine. Now you'll see here, the first thing that the patients or clients are going to do is they're going to select a clinic in my example. Now, I actually have several virtual clinics set up within my account because I wanted to show you some of the different configurations all from one place. Now, if you have just one virtual clinic set up in your account, it's just simply going to go into, what services would you like to select? So for me, we're going to start with behavioral health and scheduling a therapy session. So let's click here. The next thing it's going to want you to do is to select a service. Again, this is where I showed you your account services. So here you can see, based on how I set up my account services in my account, that's how they're going to display here on the virtual clinic. So this was the name of the service that I gave it, and this is the description that I included as well. So this can really, you have some customizable ability here to set this up and call it however you need it to appear to your patients or clients. So like for me, I said new to therapy, schedule an appointment with one of our providers. So let's do that. We're going to pretend like we're requesting a new therapy session here. So now I have this virtual clinic configured to where you're choosing from a list of providers, like I mentioned before. Now, in my case, you'll see I have Dr. Ellie Coates. So that's me. I've got my picture in here. I'm going to choose Ellie Coates as the provider that I want to schedule with. So you can see the next thing it's going to do is bring up Dr. Coates' listing, photo, nice and large here. And then it's going to show a calendar. And here, their availability is noted by the light blue dates. So you can see any of these dates on the calendar, it's saying that Dr. Coates has availability on those dates. So me as the client, I'm going to go in here and choose one of these dates on the calendar and see which one best works for my schedule. Now, the great thing is, me as the client, I can request up to 3 dates and times with Dr. Coates. So when I submit my request for a session, I can actually give some options to Dr. Coates on, when it would work for my schedule. Now, you can select just one and submit a request that way, but we do always like to encourage people to give a few options so that you can get your appointment scheduled. So let's say I'm going to request a session for November 17th, tomorrow, and let's say 3 p.m. That works for me, but I could also do 4 p.m. And then let's see, on Friday, I could do 11 a.m. as well. So you'll see here, those appointment times are going to start stacking down here below, and you can submit 3. You can also prioritize if you decide that, 4 o'clock actually really works better than 3 for me. So I'm going to make that my preferred appointment time. All right. So now we are ready to submit this request. The next thing the patient would do is click schedule session. So from here, what it's going to have me do is register as a participant user. So I'm going to register here, just give some information, my name. We're going to register as Holly Flax. We're going to include this email address, an actual email address for Holly Flax. You can enter your time zone. It's just going to default to the provider's time zone on the account, and a phone number. And then down here, you as the participant are just going to assign yourself a password. All right, so simple as that. Now I have registered, and it's going to bring up the next step in the virtual clinic process, and that is confirm your appointment request. So here's the service I've requested. It's a first-time therapy session. It's an appointment with Dr. Ellie Coates, and then here are my 3 appointment times that I've provided. Now you'll see here a series of questions that I have to submit before I can submit my request. These are all customizable questions. So you can actually choose to either include additional questions here or not, if you want to just let your participant go ahead and submit the request without giving any further information. Now you are going to receive the information that they used in their registration. You'll see their name, you'll have their email address in your account. But you may want to know, for example, their date of birth. You may need to look them up in your practice management software. So we're going to provide date of birth here. Oops. There we go. And you'll see here this red dot right next to the field indicates that it is a required field. And then you can actually choose to have them not be required as well. So if you want to make questions optional, you can, or if you want required information, you can just set it to required. So I'm going to give my insurance carrier just because I like to give all the information that's asked of me. And my policy number. Then the reason for my appointment request, I'm having a little anxiety. All right, so let's see what happens when we submit this request. So as the participant, it's now going to confirm, yep, here's me, Holly Flax. This is my dashboard. I now have a pending clinic request. And again, it's just confirming all the information that I provided. But what it's going to tell me is your appointment request has been sent to Dr. Coates. You will receive confirmation of your appointment time by email or text message. So now it says you may close your browser tab and wait for your email or text message confirmation. So let's go over to Dr. Coates' dashboard here and see what happened. As you see right here in real time, Dr. Coates has now received this session request. And of course, you as busy providers, you're not sitting here looking at your SecureVideo dashboard all day to wait for incoming requests. The system is going to send you an email or a text message notifying you that an appointment request has come in. So don't worry if you're not, looking at your dashboard and seeing this come in right away. You'll still receive notification. But here's the appointment request for Dr. Coates. She's going to see right here on the top of the dashboard who requested the session, what service they requested here, and then the answers to any of those customizable questions that she sent in with proposal is going to be included here, and those all stay right here with the session. So I can see the date of birth, insurance information, and then, cause or the reason for the visit. And here are the 3 appointment times that Holly requested. So now me as the provider, I'm going to look at my schedule and see, I think November 18th works best for me at 11 a.m. And I'm going to send Holly back a message and just say, looking forward to it. Now, this feature could be used because it's going to send this message response back to Holly. You could say things like, please be sure to complete your paperwork ahead of time, or just a reminder about your cancellation policy, something like that, that you can send a message back to your participant. Or you can leave that blank. But let's just say here, I'm going to accept November 18th at 11 a.m. So now what happens is, as soon as I click accept, that has now converted that into an actual session on my dashboard in SecureVideo. So now we have our session just as we normally would. And at the time of the session, the provider would simply click enter meeting. Now let's go back to Holly's end. And look here. Now the message or the session has been accepted. So it's going to show her all the typical Zoom prompts. I'm going to say, stop showing this message. And it's going to show, here's Dr. Coates' reply, looking forward to it. And then here on the patient side, it's looking really a lot like a SecureVideo dashboard. It's showing her, this is the date, the time of her session. And then here she would click enter waiting room to join the session at that time. But also I'll point out in Holly's email, hopefully just a quick refresh and that'll come right through. It does send a notification to the patient saying that Dr. Coates has accepted their appointment request. So if they had moved away from that browser and had gone on about their day, they do receive confirmation once that's been accepted. All right. So let's go back now. I'm going to log off from being Holly Flax here. And we're going to go back to the start for the virtual clinic. Now let's take a look at this pharmacy clinic. This one's configured in a little bit different of a way. So in the pharmacy clinic, this one is configured to where I am a patient, I'm going to request a session, and I don't get to choose which pharmacist I want to see. It's going to go to a group of pharmacists in my account. So let's say, for example, there are 3 pharmacists that are servicing this virtual clinic. So me as the patient can come in here and follow those same steps. I'm just going to click on the calendar, choose my date and time. I'm going to go ahead and schedule a session. But something to note here is that you'll see right here at the top, I can also request session now. So this is an example of a virtual clinic that is set up to accept not only scheduled appointments, but also on-demand appointments too. So either way, these pharmacists are equipped to take appointments with either workflow. So again, same thing, I would schedule the session. Now, as I go back to the registration page, it actually, because of the cookies dropped on my browser, it's gonna recognize me as Holly Flax. So if I've been here before, it's gonna prompt me to log in rather than to re-register as a new patient. But if I were a new patient, it would simply take me to this registration page again. Okay. And I'm going to go back again, and let's just point out real quick the final clinic on my virtual clinic list here, the urgent care. Now, this is a configuration where with urgent care, we don't have the future scheduled appointments configured. We have this set to where it's on-demand requests only. So imagine in an urgent care setting, you need people to be able to just request sessions right away, and then you have a staff of providers who are waiting to take session requests there. So there, they would just click request session now. And again, it takes them right to that next page, the registration page. Right. So from here, let's talk about one key thing that you may have been wondering about as we were going through this process, and that's managing your availability. Now, how does SecureVideo know when I'm available for sessions and when I'm not? Now, the three areas that we're going to talk about here are sort of layering on top of each other, but it all starts with using the appointment slots feature in your account. So we'll go through that. Then we're going to talk about how doing a calendar sync with either your Google or Outlook calendar makes this process even easier and better to manage. And then I'll show you the toggle switch for on-demand requests, which you may have already noticed as we were going through the example here. But to start, let's go through and look at one more session request as an example. Let's go back to that behavioral health for the therapy session. We're going to say I'm a first timer. I need a first time session. And let's say, you know what, I had known Henry host here, and Henry is the one I wanted to schedule an appointment with. Well, look up here. There are no availability dates for Henry host. So why? Well, because Henry hasn't put in his availability through the appointment slots feature in his account. So let's go do that now. I'll show you what that looks like, and then we'll come back to this and show how that updates here. So when I go to Henry host dashboard here, here's Henry. He's a host on my account for East Coast Medicine. And he's got a few sessions that he's already had scheduled. But if I go up here and click appointment slots, this is where I would go if I want to tell the system, hey, I'm available during certain times to take appointment requests. So I'm going to go in here and select add an appointment slot. You can select one time or weekly. So if you want this to be something like a shift where you want to take telehealth sessions during certain days and times of the week, you can do that here. And I'll show you that one as an example. So let's say we want to accept session requests on, let's say from 1 o'clock p.m. to 4 o'clock p.m. on Mondays, Tuesdays, Wednesdays, and Thursdays. So that's when I'm going to do my telehealth sessions. So once I add that, you'll see the calendar over here automatically reflects that availability. So this is saying that Henry is going to be available to take session requests during those times. So as we click on into the following weeks, you'll see this just sort of goes on indefinitely. Now, what I can do if I am, a provider, I have, let's say, an out of office slot, like I'm going to be out of the office this coming Thursday. So what I can do is just add a one-time out of office slot. And I'm going to say, you know what, but from 1 to 4 on this Thursday, I'm out of the office. Oop, excuse me. From times 1 p.m. to 4 p.m. There we go. So now what that's showing in red is that although I have this weekly availability, I've now added this out of office slot. So the system is automatically going to recognize that I can't take session requests when I'm noted as out of the office. So that's how you would go in and manage your availability in the appointment slots. So let's go back to the virtual clinic now. And we're just going to refresh this page. So now again, I'm going to behavioral health, first time session, Henry host, and now all of a sudden I have plenty of availability on the calendar. So I can go in here as the patient and just select any of these dates and times available. Now, another layer of managing availability is actually a newer feature that we just incorporated into SecureVideo earlier this year, and that is a calendar sync. So many of you I know may use a Google Calendar or an Outlook calendar to manage your availability. Henry is no exception here. He's got his Google Calendar here pulled up. So you can see here, he's got some sessions already on his calendar. And these could be personal appointments. These could be in-person appointments in your practice. But either way, you want to make it easy for the system to recognize when you're actually not available for sessions. So something you can do is go into this profile icon here, click on your own name, so Henry host. And then down here at the bottom, you can choose to link either your Microsoft Calendar or your Google Calendar. And what this is doing is syncing the calendars and your availability between those two systems. So here I'm going to sync my Henry Host calendar. It's going to ask you for permission to do that. And if I hit continue, you know that it's linked when all of a sudden you see a button pop up that says unlink Google Calendar, and you can always unlink it at any time. But here now, if I go back to my calendar, and let's just refresh this page. Go. And then back here on my dashboard. What this is going to do is now going to take into account any of the, oops, sorry, it actually didn't sync. Hold on. There we go. It just didn't. Oh, I didn't hit save. That's what it was. Sorry. Continue and save. There we go. Okay. So now back on my calendar, we should be seeing, yes, here we go. In this calendar view in SecureVideo, now I'm not only going to see sessions that I have in SecureVideo, but I'm also going to see other appointments that I have on my Google Calendar. And that way the system can know, hey, you know, Henry already has another meeting set for 3 o'clock on the 17th, so he can't be available for telehealth sessions during that time. So this is a great way, by taking advantage of this feature, to just make it a little bit easier to manage your availability and to not let your patients request sessions of you when in fact you're not available. Just saves a little bit of that back and forth. All right, let's go back here. Now the toggle switch for on-demand requests, you may have seen this on the dashboard. When I was on Ellie Coates' dashboard, for example, we have this switch at top that says I'm available for sessions, which by default is set to on. But you can also toggle that to off. Now you can configure a virtual clinic to where it's determining your availability based on that toggle switch. So if I sign in for the day and my primary work is in telehealth sessions, and let's say, for example, especially if I'm taking in on-demand requests, I can choose to turn this on or off and say I'm either available for sessions or not. And so if I'm not available for sessions, it's not going to allow anyone to send me session requests at that time. So that's something that we would typically usually only recommend for using that on-demand virtual clinic workflow because you just want to manage your availability like through a calendar program. Okay. Now, how this works with some other SecureVideo features. And I do want to pause just for a moment because I have Michelle and Gina and Sabrina on with me helping to manage the Q&A, and I think they're probably answering some questions already. But anything that's come up so far that we want to touch on to my team? You feel like everything's pretty getting answered? Okay. All right, just wanted to check on that. Now, working with some other features within SecureVideo, a few other things I want to point out are one, the branding feature. So if you're using SecureVideo and haven't incorporated the branding feature yet, the reason that this is especially useful in the virtual clinic is you're going to allow your patients and your clients to really see your brand's logo, the colors, your name, but it's also going to give you a dedicated custom URL. So if you notice, when I'm back on the booking page, do you see how the URL is eastcoastmedicine.securevideo.com/book? When using the branding feature in SecureVideo, you assign your own custom subdomain to SecureVideo. So even if that's something where you're using your own name, for example, elliecoates.securevideo.com, that way at least it sort of ties it in a little more to your brand, and you can even include your own colors. So for example, all of this green and blue, this is all just based on the logo that I made up for East Coast Medicine and can be easily going along with what your brand and how you want it reflected there. So that's one thing I definitely wanted to point out. To incorporate the branding feature, it's under features in the account and then branding. And if you're not using it, what you'll see is you are currently eligible for branding, and you can just click a button and it'll take you through the process of uploading your logo and requesting a custom subdomain. Just know that support is here to help you with that if you need any help. All right, and then another feature I just wanted to point out too is the provider listings feature. So you may have noticed also in the virtual clinic, when someone requested a session with Dr. Coates, You can see here my picture, and it has all my specialties listed here. This is all coming from the provider listings feature in your SecureVideo account. So in Dr. Coates' dashboard, again, it's under features and my listing. So this is where I went in and set up. I uploaded my own photo. I used the checkboxes down below to just talk about what kind of practice types I cover. As you can see, I'm, quite a broad range of specialties here. And then my areas of practice, you can actually note in here which states you're licensed to practice in, and then any other sort of credentials, things like that you want to enter. So anything that you enter into this listing will show up in the virtual clinic booking page. And that can just help, especially if you're meeting with clients for the first time, just help them get a sense of who you are, what you specialize in, and help them at least get to know you a little bit before they request a session. Now you can see here, it doesn't have to be done. For Henry, for example, it does not have a provider listing. His name would still show up in the list of providers, and it would just show a simple head and shoulders icon. So the process still works without the provider listings, but you can see what a difference it makes when someone goes to request a session to have that all completed there. So I definitely recommend using that too. And then finally, incorporating e-documents. So I know a lot of our users are using the e-documents feature in SecureVideo, and there's a couple different ways that you can incorporate that into the process of the virtual clinic. One, let's just go back to the main booking page here. And we're going to go up to this pharmacy request. I'm going to go ahead and submit a request through the pharmacy. Again, just showing you the process of what it all looks like. We're going to schedule a session. We're going to register as a patient here. Let's just register as someone new. And then enter a password. Okay, so I'm Johnny Appleseed now, and I'm going to submit my session request with the pharmacy. So my date of birth. I'm going to leave these blank because these are not required fields, and submit my request. All right, so now my request is pending. Let's go to Dr. Coates' dashboard here. And, oh, she didn't get the request. Let's see, she probably doesn't have availability at that time. 1 second, let's see if Henry Host does. Oh, no, he doesn't either. Oh, sorry. Tell you what, let's go through and pick a different time. Bad luck on my part there. We're going to cancel. And let's pick another time. And a few different times, actually. Here we go. And submit. Let's see if that does better. Okay, here it comes. So here's Johnny Appleseed's request, and Dr. Coates sees that request and she accepts. So now, because I have actually assigned this telehealth consent form to be a default form as part of this process, what's going to happen now is Johnny Appleseed is going to automatically be assigned that document to complete before he can enter his session. So if I go back to Johnny Appleseed's dashboard, and let's say it's the time of my session and I go try to enter the waiting room, it's actually going to stop me because I have this set to a required form that I have to fill out this document before I can proceed and enter my session here. So, okay, Johnny, we're going to go ahead and sign this. And there we go, submit. So now I could enter my session and proceed. But that's just an example of how you can go ahead and assign a default document packet into the process of the virtual clinic and go ahead and have your patients or clients complete paperwork during the process of making their session request. So it just makes the whole process a lot smoother. Now, one exception to that may be, it may be a situation where, depending on what service they request, depending on the patient's situation, you may not want to automatically by default assign them paperwork. So let's just say that you had this other session request come in. I'll just show you another example. Here's Clark Griswold. He's having some pre-holiday season anxiety here. So we did not assign him a default document packet, but what you can do is just go into edit by his name, and any of the document packets that you have set up in your account, you can go ahead and assign those even after you've already accepted the session request. So let's say I want to assign him the telehealth consent form. You would just simply select it there and click Save. And now when Clark goes to enter his meeting at the time of his session, or if he were to go to his dashboard and log in ahead of time, he would see now that he has a required document ahead of time. So that's a couple different ways that you can incorporate e-documents into the virtual clinic process. All right, let's talk about pricing for this feature. As I mentioned, for most of you, especially on this webinar, you're going to have a virtual clinic included with your SecureVideo license. The restriction is that we allow one virtual clinic for up to 3 providers at no charge. So even if you have one SecureVideo account, and let's say you have 3 of you practicing together all within your organizational account, you're going to have a virtual clinic available to you at no additional cost. Now, the exceptions are going to be if you have over 3 providers, let's say you're a group of 10 and all 10 of you want to be listed in the virtual clinic. The additional cost for that is $30 per month per provider over 3. So there is just some cost depending on how many providers you have in your account. And then the other cost consideration to factor in is if you need multiple clinics for some reason. And an example of that is like what I showed you in my demo account. If you remember, I have several different virtual clinics set up in my account because I wanted to show you all those examples. So if this was a situation where it's an account that has multiple departments or where you have the need to set up separate virtual clinics for some reason, there is additional cost consideration for additional clinics. So just keep that in mind as you go into using this feature. But like I said, for the majority of you, there's not going to be any additional cost involved unless you, again, have more than 3 providers or need multiple clinics. All right, let's stop there. I'd love to take some questions or touch on anything as far as questions that have come up while I've been jabbering on for about 40 minutes. So let me know if anything's come up, or we'll keep an eye on the Q&A right now. Yeah, looks like a lot of questions have been answered so far. Good. Will appointment slots still show as available if I already have a session booked at that time? Yeah, great. Yeah, Michelle noted in the answers, if you already have a session on your dashboard, it's not going to show you as available at that time. So it's a great way to, keep from double booking yourself. Okay. Any other questions? Don't be shy. All right, in that case, I will open it up to Sabrina, Gina, Michelle, anything you feel like about the virtual clinic feature that I have glaringly overlooked or should maybe circle back on, anything that you'd like me to touch on in addition. Otherwise, we can touch on some next steps. And if you're thinking about incorporating this process, some of the things that you could be doing to go ahead and get the wheels in motion for this. All right, well, let's do that. So the next steps, really, if you're interested in incorporating this feature, you do need to get support involved because there are a few things that we need to just check off in your account, enable for you. But some of the things that you can do on your end to get started are to, at least create one service in your account services. So I showed you in your account, that's up in the profile icon, and in that drop-down menu, it's account services. So you'll need to designate at least one service that you want to make available in your virtual clinic. So you could go ahead and be doing that. And then you need to decide if you're going to offer the appointment-based workflow or the on-demand, so where you can request sessions right away. So our support team will need to know that too. And then if you'd like the individual list of providers where you're allowing your patients or clients to select from a group of providers, or whether you want it to be a group configuration where all of you are seeing the same appointment requests and the first one that's available can grab it and fulfill that request. And then a couple of the optional ones that we covered to set up the branding feature in your account, and then your provider listings. Again, those can just make the virtual clinic a bit more customized for you and a little bit more attractive throughout the process of your patients or clients requesting sessions. And then the custom question fields. So if you recall, I had put in information like date of birth, insurance information. Those are all optional. You don't really have to have a lot of questions. And in fact, we really do recommend probably the fewer questions, the better, because the idea here is that you want your clients or patients to be submitting session requests with you. And so to give them too many barriers or things that they have to look up or information they have to think about, could be a barrier for them to actually submit the request. So I'd say, the fewer the better, but if you need some information from them, just to even qualify them as a possible client, then you could set up those custom questions there. So that's a good thing to think about in advance as well. All right, with that, I'm going to be able to give you a little bit of time back in your day. We really appreciate those of you who attended. And then, of course, we will be sending this recording out to anyone that registered and wasn't able to join us today. So hopefully there's some good material here that you can refer back to later. And again, if you're having any questions as you go to set up the process or need any help or have specific circumstances that you want to talk through, please don't hesitate to reach out to Sabrina or myself. We're always happy to meet with customers one-on-one if we can talk through what your needs are and help you get this process started or get you set up. I did see one other question pop in. Yes, I did cover the added costs, and I'll just go over that real quick. Again, we'll just back up a couple slides here. So for people who have an account with up to 3 providers, you are given 1 virtual clinic at no additional charge. So for 1 to 3 providers on your account, no charge. The additional cost comes into play when you have more than 3 providers. So again, if you're adding, up to 10 providers, for example, the cost then becomes $30 per month additional per provider. So there's cost considered if you do have, a large group of providers that are all going to be using this feature. Or additional cost if you have multiple clinics that you need set up, like in the example I showed with behavioral health clinic, there's a pharmacy clinic and an urgent care. So separate departments within an organization, for example, there's some cost factored in there too. And of course, Sabrina and I can always work with you one-on-one to determine what your needs are and determine what a specific cost would be. But for the most part, we feel like, if you have 1 to 3 providers on your account, you're not going to have any additional cost on this feature. All right. Again, thank you so much for attending. Please don't hesitate to follow up with support or us if we can be of additional service to you. And we just always like to say, thank you so much for using Secure Video. We know you have lots of options out there, but we really do value our customers and hope that these webinars are helpful as you better understand the product and understand its value. So thank you so much. Hope you all have a wonderful day.